Hi everyone, Vanessa here from Blue Frog Wellness. In today's video, we are going to be exploring how traditional Chinese medicine, or TCM, understands and treats trauma. And this is not just from a psychological perspective, but truly from an all-encompassing body, mind, and spirit balance, because in traditional Chinese medicine, we cannot separate those things. They are all encompassing, all together, incorporated in your overall well-being. So today I wanted to give you a brief overview on how TCM views and treats trauma, and how there are 3 specific pathways using acupuncture that can support your healing. Before we begin, I want to be clear that I'm not a medical doctor and that the purpose of this channel is for educational purposes only. So if you happen to have a mental or physical health complaint, please do not hesitate to reach out to a professional healthcare provider. When we talk about trauma from a TCM perspective, what we're really talking about is a disruption in the natural flow of qi, or your energy. This is the energy that is animating and connecting every part of us. Trauma, whether that be physical or emotional, creates what we might call a vibrational energy, or a blockage in our qi flow. And as Elaine Duncan beautifully says in her book, The Tao of Trauma, trauma is a vibrational experience and acupuncture is a vibrational medicine. Therefore, acupuncture and traditional Chinese medicine wonderfully treats mind, body, and spirit when we've experienced trauma. So before we dive into the 3 different pathways that acupuncture can be used to support your healing journey with trauma, we need to understand a little bit more about the Chinese medicine perspective on exactly what happens when we become traumatized. So in TCM, really we see 3 different major organs that are impacted whenever we have any kind of physical or emotional trauma. And they are the heart, the liver, and the spleen. In TCM, trauma impacts several key organ systems. The first is the heart. And the heart in Chinese medicine houses the Shen, or the spirit. And so anytime we have a traumatic experience, it can cause the Shen to scatter or dissipate or be in some way disturbed, leading to anxiety, insomnia, restlessness, or a feeling of disconnection from yourself and others. So in Chinese medicine, we use the phrase, the heart anchors the Shen, meaning that the heart organ houses and stabilizes the Shen, which encompasses a person's mind, consciousness, spirit, and all aspects of their emotional life. A strong and healthy Shen is supported by sufficient heart blood, leading to clarity, inner peace, and joy, while imbalances or deficiencies in the heart can manifest as emotional and mental disturbances. Secondly, we have the liver. Now, the liver in Chinese medicine really is there to ensure the smooth flow of that qi and the smooth flow of your emotions. After trauma, liver qi can become stagnant. It can show up as irritability, frustration, or a feeling of being stuck. Left stagnant for long enough, this can turn into depression. And thirdly, we have the spleen. The spleen helps to process our experiences. When trauma overwhelms us, the spleen can weaken, leading to worry, overthinking, brain fog, and cognitive issues. Also, we can see some digestive issues and fatigue because the spleen becomes impaired. Now, these 3 organ systems often work together. When one is out of balance, the others are often affected. The good news is that acupuncture and Chinese medicine can restore their harmony, helping your nervous system find safety again. So there are 3 different pathways that we can use acupuncture to restore balance after any traumatic experience. And you may be the most familiar with the first one, which is body acupuncture. So body acupuncture balances the organ systems we just mentioned. It moves stuck qi, it can regulate the nervous system, and it also is very, very helpful when you actually have physical symptoms alongside of the mental emotional. So when you have that tension residing in your shoulders and neck, often leading to occipital or tension headaches, rigidity in your tendons and your ligaments, such as having tight hips or restricted IT bends, or you just overall feel physically and mentally stuck. Body acupuncture is wonderful because we have different modalities we can use alongside the acupuncture that fall underneath Chinese medicine umbrella, such as fire cupping and moxibustion therapy, electroacupuncture therapy, and Tuina massage therapy. And all of those therapies alongside the actual acupuncture work to release fascial adhesions, tight muscles, the restrictions that we feel, those muscle knots that we have built up from holding on and gripping on and being very tense for a long period of time and not freely moving and opening ourselves and our bodies when we are feeling that overwhelm or the chronic stress and tension from any kind of traumatic experience. So body acupuncture is wonderfully relaxing. It's done one-on-one in a clinic with an acupuncturist or a doctor of acupuncture, doctor of traditional Chinese medicine, and it is wonderfully effective and restorative for you. So the second pathway we have is ear acupuncture or auriculotherapy. You may be a little bit less familiar with this modality, but it is very profound and it's being used more and more globally to address stress, addictions, and trauma. Now the ear is a microsystem of your whole entire body, so every point we have on the physical body can be reflected in the ear with the addition of brain points and nervous system regulating points. In addition to having a mirror of your whole entire body mapped onto your ear, we also have a very regulatory effect because, like body acupuncture, we're looking to get that flow of qi restored once again. So whether you have high blood pressure and use the blood pressure point on the ear to bring down your blood pressure, perhaps somebody else has low blood pressure and we use that same blood pressure point to elevate their blood pressure. It's all based on homeostasis and bring your body back into balance. So it's wonderfully effective, very low risk because there are no nerves, major organs, anything that can really cause any damage with acupuncture at your ear. And it's very, very effective, especially done in group settings, which is commonly administered. The third pathway we have is Five Element theory. Five Element theory in Chinese medicine works to address a little bit more niched spiritual, mental, emotional pathologies that we might be seeing in our patients, and it really helps to restore harmony, connection, and balance after trauma. The leading authority on this type of work in the United States is Elaine Duncan. She wrote the book, The Tao of Trauma. And Elaine's work, not only clinically, but as a researcher, really shows how we can bridge the gap between polyvagal theory and TCM 5 element theory, because really they're saying the same message. And it's the same cycle that we see. So her work really wonderfully encapsulates where someone might actually be stuck in that self-protective response cycle and how we can nourish that area of the whole cycle to be able to restore balance and get them to process the trauma that they've endured so that they can move forward in life. And the beauty of this is that, yes, it does address a little bit more complex trauma, which often comes down to those adverse childhood experiences or ACEs that we now know cause a lasting imprint in the body that may show up in adulthood as triggers by some other event. So no matter which pathway you choose to go, all of these will work vibrationally using the resonance of needles, of touch therapy, and energy to restore balance to your whole mind, body, spirit system. The key takeaway here is that TCM offers multiple pathways for healing trauma, whether that be body acupuncture, ear acupuncture, or 5 element theory acupuncture, or some combination of them all. Depending on your needs, you might find that one pathway is more effective or more accessible than the others. In upcoming videos, I'll take a much deeper dive into each of these three modalities so you have a better understanding of their historical roots, where they came from, and why they can be so effective in helping you heal trauma. Remember, trauma doesn't have to define you. Using TCM, we can restore flow, release that stuck energy, and return you to your zone of resilience where you're feeling safe, connected, and more like yourself once again. If this resonates, please do hit the like and subscribe button, as well as hit the bell so that you can be notified when we do those deeper dive videos into each of these three pathways. I wish you well on your healing journey. Thanks for watching.